Hello, my name is Dr. Dean Burnett. I'm a neuroscientist and Honorary Research Associate at Cardiff University Psychology School. This lecture is on therapies for heroin addiction and a contrast with alcoholism. So we hear a lot about heroin addiction, but how is it dealt with? What are the treatment options available for a chronic heroin addiction? When people hear about treating heroin disorder, perhaps the most obvious assumption is rehab. Thanks to the influence of Hollywood movies and the like, the notion of someone struggling with addiction being whisked away to a rehabilitation centre, probably a glamorous resort where they're kept away from the source of their problem in sufficient comfort for long enough to get the drug out of their system. This is a common portrayal of how addictions like heroin addiction are dealt with in mainstream media. And yes, true, such an approach or such approaches are recognised, available, and can be quite effective. It's also a very expensive and resource-intensive intervention, and not one available to the typical heroin addict, more the reserve of wealthier people who fall into addictions for various reasons. So what can be done if you're not the sort of high-flying superstar who can afford a stint in a rehab on a tropical island? A lot of heroin treatment for the masses involves, perhaps ironically, drugs, or as they're more accurately known, medications. Medication for drug addiction typically fall into one of three categories: aversives, agonists, antagonists. Aversive medications treat drug addictions by causing the brain and body to have the opposite response to what would usually occur when you take the drug. As in, if the source of the addiction, such as heroin, usually produces pleasure, after consuming an aversive medication, it'll actually cause pain or substantial discomfort. This approach relies on the concept of negative conditioning. It aims to teach the fundamental learning systems of our brain that what they thought was good is now actually bad. It's a harsh approach, but it can be effective. Agonists are medications that trigger the same systems as the addiction drug in the same way, but less so. They're often called partial agonists because they do the same thing to a lesser extent. This is a viable approach, as it can often mean the unpleasant aspect of drug withdrawal is suppressed or mitigated because the relevant brain systems are being activated, but the pleasurable aspect is missing or reduced. So the addicted brain can more gently learn to deal with the absence of the drug. And antagonists work with the same receptors as the addicted drugs, the same neurons, but they block or prevent any positive effect. If a drug and receptor are like a key in a lock, antagonists snap the key off and run away, so the lock won't open for anyone. Thus they prevent the effects of the addicted drug, and so the brain learns that it no longer works, so the addiction is lessened, hopefully forever. As well as medical interventions, there are numerous therapeutic approaches, ranging from group sessions to one-on-one counselling. The best approach varies considerably from person to person, as everyone has their own personal situation to consider which led to the addiction in the first place, and the consequences of that for their lives and their situation. But overwhelming evidence reveals that drug-based interventions are most effective, if not even only effective, when combined with therapy. Because in almost every case, there is a psychological or social psychological reason why someone ended up addicted to heroin or whatever it is in the first place. Addressing that can often be a vital part of the treatment. So why are we comparing heroin addiction to alcoholism? Well, because heroin is arguably the most severe and powerful form of addiction, alcohol addiction is by far the most common. I know many doctors who work or have worked in addiction treatments, wards and centres, and in terms of the representation of patients, they may as well be called alcohol plus guests centres or wards. So yes, while perhaps less severe in the grand scheme, alcoholism is the bigger societal problem in terms of raw numbers. One of the ways in which treatment of heroin and alcoholism differ is the extent medication can work. With alcoholism, cutting back, reducing your intake can indeed be a viable approach. The individual can be relied upon more often than not, perhaps, or at least to a great extent the heroin, to regulate their own intake and reduce it gradually. This usually works in the more modest cases, but it's still something that needs to be considered. Heroin, by contrast, doesn't quite work that way. It's very hard for a heroin-addicted brain to have a little bit of heroin and make do with that. The deep fundamental biological changes in the brain caused by heroin make this a much harder proposition. The drug interventions also differ. For one, aversive drugs are a more viable option for alcoholism. A number of drugs are available and often used that make an individual extremely sensitive to alcohol, or encounter it makes them nauseous, feverish, and so on. While this can be a problem because many everyday products like aftershave contain alcohol, so it's possible to encounter alcohol without wanting to consume it at all and still have the bad reaction. It is helpful though because alcohol doesn't have the same neurological impact as heroin, it is far more readily available, so some may need that help to avoid it. By contrast, a heroin-addicted brain is already highly primed to experience pain and discomfort, as we discussed in the previous lecture. So a drug which causes the same in response, the only thing that prevents it, is not the best approach. It doesn't really achieve anything different. Therapeutic interventions also differ. For various reasons, alcoholism is more recognized and therefore more accepted than heroin addiction. Hence you get things like Alcoholics Anonymous, which everyone recognizes. The stigma and perception of alcoholism, alcohol addiction are different. They're there, but they are different, meaning therapeutic options and the consequences are also different. Heroin Addicts Anonymous may be a thing if it does exist, but it's far less mainstream. There's a lot more stigma around heroin addiction still. So the therapeutic approaches and the motivation to pursue them will differ from case to case for these particular addictions. But overall, this shows that addiction isn't just a one self-contained condition. The source of the addiction and the extent to which it is used is a significant factor in how it's treated.